Imagine your mind as a bustling metropolis. Sometimes, the streets are filled with people rushing about, their hearts pounding with excitement. This is anxiety, a state of heightened alertness, preparing you for a challenge. Other times, the city is shrouded in fog, the inhabitants feeling lost and alone. This is depression, pervasive sadness that can drain your energy and hope. While anxiety and depression may seem different, they share a common ground: the imbalance of certain neurotransmitters, or chemical messengers, in the brain. Both conditions often involve disturbances in serotonin, norepinephrine, and dopamine. Serotonin, the feel-good neurotransmitter, is frequently low in both anxiety and depression. Norepinephrine, involved in alertness and stress responses, can be elevated in anxiety but low in depression. Dopamine, linked to pleasure and motivation, can be reduced in both conditions. Despite these similarities, anxiety and depression have distinct characteristics. Feelings of worry, fear, and restlessness often characterize anxiety. People with anxiety may experience physical symptoms such as rapid heartbeat, sweating, and difficulty concentrating. Depression, on the other hand, is marked by persistent sadness, hopelessness, and a loss of interest in activities. People with depression may also experience changes in appetite, sleep, and energy levels. Treatment for anxiety and depression often involves a combination of medication and therapy. Antidepressants can help regulate neurotransmitter levels, while therapy can provide coping strategies and support. Cognitive behavioral therapy, CBT, is particularly effective for both conditions, as it helps individuals identify and challenge negative thought patterns. In some cases, individuals may experience both anxiety and depression. This co-occurrence, known as comorbidity, is common and can make managing these conditions more challenging. If you believe you may be experiencing both anxiety and depression, it's important to seek professional help. A mental health professional can assess your symptoms and develop a personalized treatment plan. Let's explore the relationship between anxiety and depression in more detail. Anxiety can often be a precursor to depression. When individuals are constantly stressed and overwhelmed, it can lead to feelings of hopelessness and despair. Additionally, the physical symptoms of anxiety, such as fatigue and difficulty concentrating, can contribute to a depressive state. On the other hand, depression can also exacerbate anxiety. The sense of hopelessness and helplessness associated with depression can make individuals more likely to worry about the future and anticipate negative outcomes. This can create a vicious cycle, where depression leads to increased anxiety, which in turn worsens depression. It's important to remember that everyone experiences anxiety and depression differently. What works for one person may not work for another.